Hey y'all, it's Julia, aka JuJu Rose. Welcome in or welcome back to my channel if you are a recurring watcher. Today we are here, we're going to do a series of breastfeeding troubleshooting and for first time moms and new moms who have trouble with breastfeeding. So we're going to demonstrate some different positioning. We'll demonstrate how to use the nipple shield and give you some acronyms that may help in the troubles you're having with breastfeeding. And today we have a special guest. Selena is a mother-baby nurse. So once you deliver postpartum, she takes care of the mommy and the baby until they go home. If this is something that interests you, then just keep on watching. So first we'll start with the stomach size of the baby. It's a lot of controversy about if the baby's starving or if the baby is hungry. So I just want to clarify how big the baby's stomach is when they're first born, and it doesn't take a lot to pull a baby, because a lot of moms I hear at work are always saying, oh, is the baby getting enough? Is the baby starving? And we constantly tell them, yes, the baby's getting enough. The baby's stomach is only so big. So on day one, this is the size of the baby's stomach. See? Like a cherry.
About the size of a cherry.
Yeah. And on day 3, it's about the size of a walnut. See that? So on day 3, your milk should be coming in. So if you're worried about them getting too little in the beginning because they're just getting the colostrum, it's okay. As you can see, the stomach is small, and by day 3, you have your full milk supply.
Is my baby getting enough? Is my baby getting enough? That's the #1 question with breastfeeding. But if you hear swallowing during nursing, if the baby is making wet diapers or poopy diapers, and if it hasn't lost greater than 10% of its birth weight, those are some key signals that the baby is getting enough.
Yep. So we'll go ahead and start with nipples. Everyone has different nipple sizes. Everyone is different and has their different troubles with nipples. Commonly we see individuals have like a flat nipple or inverted nipple. The next nipple size, people will have maybe like a longer nipple. You can see that. And then this is more like a normal size nipple, small, not too flat. So we'll demonstrate some different tools for that, okay?
Another issue, some people have a lot of large breasts, a lot of breast tissue, and we'll also show you some better positions when your breasts are larger, things you can do to support the breast while the baby's nursing.
Okay. Okay guys, so we'll get started.
Prior to feeding the baby, you want to make sure you're comfortable, empty your bladder, come back, make sure you're relaxed. We'll go through a little acronym. It's called B.R.E.A.S.T.
Yeah.
Okay. So you want to breathe. B stands for breathe. Breathe, take a deep breath, relax. Because if you're not relaxed, the baby won't be relaxed, and the baby will be able to sense your anxiety. So you want to relax. And R stands for reposition. If you're having difficulties, you can always reposition the baby. So we'll demonstrate on JuJu. The first position she's doing is what we call the football position, where she is holding the baby like a football. Always bring the baby to your breast, not yourself to the baby, because then you end up strained, you're in pain, you're uncomfortable. So always bring the baby to the breast. And you want to make sure the baby has a wide open mouth before bringing the baby on. Make sure that tongue is down, and then as she's doing, you can use this hand to compress your breast, help get some of that colostrum down to help the baby in the beginning. And the more dark part is in the baby's mouth, the better. Your areola darkens throughout pregnancy so the baby can see where they need to latch, which is pretty interesting. So that is the football position. If you're not really getting, this is actually a good position for women who have larger breasts. That is a better position. So you can try that. Some people use a washcloth to put under the breast to support it as well. So that's a position. If it doesn't work for you, you can change. We also have the cradle, which will bring the baby around and use this arm to cradle the baby. You want to make sure the baby's ear, shoulder, and hip are all in a line, and that the baby's not turned like this and trying to get its mouth. You want to make sure tummy to tummy. Always keep the baby tummy to tummy with you, right? So she's cradling the baby, and she's again using this other arm to support, get the perfect latch, get some of that colostrum down. There's also a cross cradle where she switches her hands. This hand supports the baby, and then this hand comes in here to compress the breast, like what you were doing before. Compress the breast, you can always also grab it just like that. So that's another position some people like. You can use your boppy pillows, whatever you need to support the baby down here. Have adequate back support. Make sure you're comfortable with this position. And then lastly, well, there's two other positions where the baby you can use when the baby gets older and bigger, which is the lying back position, where she'll essentially lie back and the baby kind of gets him or herself on like that. Or some people use the side lying position where you're lying down on the bed a little more comfortable when you're more comfortable with the latch and the baby. So that's for later on, and we can talk about that. E stands for express, like what JuJu was doing. Hand expressing, compressing, pressing, all of that. You can hand express a couple drops. The baby can figure out what's going on, get interested. Hand expression is very good, especially in the early stages. Okay, with A, so B was breathe, R was reposition, and E was express, hand expressing that colostrum. You want to use your thumb and your forefinger around the areola, back towards the chest wall, and then coming down using the breast tissue and getting that colostrum out. Some people are tempted to just pinch at the nipple, but there's actually no breast tissue there to get the colostrum out. You want to go farther, a little bit farther back around the areola, okay? So alternative methods you can use. A is for alternative methods. If the baby's still having trouble latching on, you can hand express into a medicine cup, the 30 ml medicine cup. You can cup feed the baby, you can syringe feed the baby, you can finger feed the baby so that you're still using your breast milk, not introducing any other type of milk, and that the baby is still getting that great benefit of the colostrum. Okay.
Yes, and I'll add to that, you guys. A lot of women are always saying, oh, well, I can't breastfeed because the baby won't latch. There's other alternatives. Like she said, you can put some in the syringe, you can put it into a medicine cup, a spoon, anything to get those nutrients to the baby. So just because your baby does not latch does not mean you cannot breastfeed, because you can hand express and then you can pump once your milk comes in.
So baby will still get the breast milk until you get your latch established.
Right.
So babies are born to breastfeed. Some is easier than others, but that's why we provide this video, so we can work at it.
Yep.
Okay, last two. S is skin to skin, which we call the magical solution. Always want to make sure you put that baby skin to skin first. Get that baby in the kitchen. This is the baby's kitchen. You are your baby's pacifier. Skin to skin regulates baby's temperature, blood glucose levels if the baby's struggling with that in the first 24 hours. Perfect, just like that. You want to make sure as much skin as possible is touching the baby. Strip that baby down to a diaper. You can go ahead and put a little hat on if you want and just get that baby on your chest for the skin to skin. And lastly, T is technique. All those things work into creating a good technique. You know that you have it down pat. If you don't have any pain, it might feel like the baby is tugging, but it should never feel like the baby is pinching you or on the tip of your nipple. You can hear the baby making swallowing sounds when you're feeding. The baby's mouth is wide open like fish lips. The lips are flanged and the baby's latched on, and you know you have a perfect technique. And those are some breastfeeding troubleshooting tips.
Absolutely. And a lot of women always say, oh, how do I know the baby can breathe? How do I know the baby's not choking? You can just listen. You hear your baby breathing, and you can make space for their little nostril when you're feeding. And then it's always suck and swallow. If you can hear them swallowing, you know they're getting something, and you know that they're breathing.
Because babies have this little thing on the side of their nose that we don't have as adults, and it helps them to breathe. It goes up a little bit when they're breastfeeding. So all of this was made so that your baby can breastfeed successfully.
Absolutely. Also, if you do not follow me on Instagram, my page is The Melanin Milk, and on that page we promote breastfeeding awareness and also postpartum depression awareness. I just did a video on some common things with postpartum depression, so ladies, if you are suffering from that, please watch my video before and feel free to come forward or share your story with me as well. And I think we are going to wrap up today's series. Is there anything else you want to say, Selena?
Nope.
So in closing, although this video was for women breastfeeding and struggling with breastfeeding in the early stages, we do understand that some women choose to supplement with formula or primarily formula feed. We do not discriminate, but we hope to provide some tips and insights on breastfeeding. So I hope this helped you guys out. If you liked the video, please like, comment, remember to subscribe, and also click the little bell button so you get a notification every time JuJu Rose posts a video. Until next video, see you guys later. Bye guys. So So first, we'll talk about, and ladies, although this went, oh my God, I was gonna say this women. Ladies, although,